Hi, everybody. My name is Dr. Kukreja. I'm here to discuss endoscopic sleeve gastroplasty. This is a new procedure. We've been doing it here for quite a while, and we're excited to offer it to our patients as a completely non-surgical option for patients looking to lose weight. Now, this is not intended for everybody that's overweight. This is best suited to people who are on the lower spectrum, typically a body mass index of around 30 to 35, maybe even up to 40, people who are looking for 40, 50, or 60 pounds of weight loss. You may have heard about endoscopic sleeve. It's called the Accordion Procedure by some because we literally shrink down your stomach. And so we're going to go through a frequently asked questions list here real quick. So question number one, often asked, is exactly what's involved in endoscopic sleeve? Well, for the procedure itself, you go to the GI lab where you go undergo anesthesia. An endoscope or a camera is put down your throat. That camera goes down to your stomach, and we make sure there's nothing wrong in your stomach, there's no polyps, there's no ulcers, etc. We use a coagulation device to mark the runways, so to speak, and so that helps us to figure out where the front of the stomach is and where the back of the stomach is. Once those runways are marked out, these are two parallel runways almost like railroad tracks, we use a specialized suturing device. This is a device that stitches the front wall to the back wall of the stomach. And what that does is it makes a narrow channel in your stomach, and that channel is designed to be very similar to that of a surgical sleeve. And you may have heard of a surgical sleeve, and that makes your stomach about the size of a banana. Well, that's the goal here. And the stomach actually not only becomes narrower, but as it scrunches down, becomes shorter. And those two things together help people to lose weight. Well, the average person should lose about 20% of their total body weight. So if someone that we're doing this procedure on is about 200 pounds, on average, they'll lose 40 pounds. And so, like I said before, this is intended for a BMI between 30 and 40, really optimally BMI between 30 and 35. The best candidates for this procedure are people who have tried to lose weight before, are familiar with diet plans, are familiar with exercise plans, but haven't been able to see the results they want. And this is not magic. This works by shrinking the stomach. As far as we understand, it doesn't dramatically affect the gut hormones, but it helps people to feel fuller, faster, fuller, easier, and to lose weight. Unfortunately, this is not a procedure that's paid for by insurance in most cases. We've really not been successful in getting insurance to pay for it, and so this is a cash-based procedure. It's done completely as an outpatient. Most patients who have the procedure are on their way home within about 2 hours of the procedure, sleep in your own bed. You may have some abdominal pain, some cramping for a day or two, maybe even 3 days. And quite honestly, most of our patients have almost no symptoms by the second day. You'll have some nausea medications made available to you just in case. Rarely you may need some fluids in the IV, but for the most part, recovery is fairly seamless for most people. Now, some of you that may have been researching this procedure have been told it's reversible. It's not. The stitches that we use when we do this procedure are made of proline, and so this is not a stitch that's designed to dissolve. It's a permanent stitch. Now, stitches can certainly break. The possibility of that is thought to be around 4%, but the procedure is not reversible. Once it's done, it's done. We can't go back. It could be revised if it needed to be revised to another procedure, most likely, but it's not reversible. We do recommend, especially as people are losing weight, that you're on vitamins. As you're losing weight, we want to make sure that your micronutrients are in line and everything is appropriate. And so we do recommend patients be on vitamins with the endoscopic sleeve. The procedure itself is about an hour to hour and 15 minutes. And there's a few minutes on the front side, a few minutes on the back side for anesthesia, but hour 15, maybe even hour 30, but it's not a terribly long procedure. This procedure, as I mentioned at the beginning of this video, is new. We've been doing this for a little while now. The longest term published data is about 2 years. And it's been around for about 5 years, but this isn't one of those procedures that's been around for 30 years. And so it's new. We're still learning. Techniques are being modified. But I would say that we're at a place now where we feel comfortable that we're doing the procedure consistently and able to reproduce it reliably between patients. And the last thing is, after you have an endoscopic sleeve or an ESG, your diet is quite